News everywhere.
We as doctors, and we have financial means, we're not poor, we can help, and we're going to do whatever it takes to help to get this hospital up and running.
Due to the shortages of staff, the Lachine Hospital intensive care unit is closed and the emergency room is partially closed. Physicians here are now offering a $15,000 incentive per year for 2 years to the first 3 respiratory technicians who decide to come work at the hospital in order to reopen the emergency room.
If we could come up with inhalation therapists for the hospital, we could open up 24/7. So we put out incentives. The doctors are all contributing. For the first 3 inhalation therapists that come here, we will provide them a $15,000 bonus each. For the next 2 years, that's a $30,000 package.
As of November 7th, the Lachine Hospital's ICU is completely closed and its ER only open 7:30 a.m. to 7:30 p.m. Outside of those hours, ambulances are being redirected to other ERs. The McGill University's health center that runs the hospital said it was suffering from a lack of staff, facing a critical shortage of nurses and respiratory therapists. Dr. Paul Saba says that they requested incentives to help entice staff from the provincial government, but no response. So he and other Lachine Hospital physicians are putting their money where their mouths are and potentially help regain staff.
We actually experienced the shortage because we did have the inhalation therapists, but the government gave bonuses, salary incentives for them if they went downtown.
In a statement to City News, Annie-Claire Fournier, Media Relations Advisor, McGill University Health Center, says the MUHC respects the decrees of the Quebec government. The collective agreements signed by the government and the unions determine all the incentives and their application. Different units can have different premiums. The nurses and respiratory therapists of Lachine Hospital receive all the premiums to which they are entitled.
They've been asking for this for years, and the last few days when I spoke to the management of the MUHC, the government still hadn't given this salary increase to our workers.
I have to congratulate the doctors for doing that. I think that is a great gesture of those people.
It's my local. I've come here forever. I've lived in Lachine for most of my life, and my doctor's affiliated with it, so I think it's a good hospital. It just needs a little more love and care.
For the MUHC and the government to oversee this partial shutdown, and for us, it's going to be, it cannot lead to anything good. So we feel in a way that they're stealing our resources, that they're dismantling one of Canada's premier, best hospitals in the country, and it's inexcusable.
In Montreal, Pamela Pagano, City News.